This is a pulmonary treatment project by Rachel Zeidema, Kelsey Bolin, Michaela Akers, Bill Adams, Haley Barnett, and Nicole Abraham. The purpose of this project is to determine appropriate treatments for a cardiopulmonary patient given a diagnosis and list of impairments. The patient case that we have chosen is Kenneth Hauk, a 21-year-old male who sustained a T4 Asia C spinal cord injury following a motor vehicle crash. Mr. Hauk was discharged after 23 days in the ICU, where he was on the vent for 19 days. He has been on room air but developed hypoxia, evident by SpO2 of 79% during physical therapy. He has pronounced weakness of respiratory muscles due to prolonged period on the vent. The medical issues that he presents with is the T4 Asia C paraparesis, hypoxic respiratory failure, risk of CO2 retention, skin care management, bowel care, and requires PT and OT consults. Alright, due to your SCI injury being T4, it's really important that we strengthen the muscles that you're able to use that are innervated by nerves above T4. We can do that by using the inspiratory muscle trainer. So what we're going to do is we're going to adjust the resistance to what should be appropriate for you right now. So what you're going to do is you're going to plug your nose and put your mouth on this piece here. You're going to relax your shoulders and take a deep breath in, expanding the chest as much as you can. And then you're going to breathe out through the mouthpiece. Plug your nose as well. Good. And you will repeat this 5 times, and then you'll take a 30 to 60 second rest, and then you'll repeat that for 3 more sets. This next technique is called stack breathing. It can also help with oxygenating your lungs as well as clearing any secretions that may build up in your chest. You're going to do this by putting one hand just above your chest, and one right below your rib cage. What you're going to do is you're going to take a deep breath in and hold for 1 second, and then take another deep breath in and hold for 1 second. Take another breath in and hold for 3 to 4 seconds, and then exhale through your lips like this. You're going to repeat this 2 to 3 times with breaks in between to rest and to cough out any secretions.
Okay, Kenneth, this is an acapella. It is an acapella choice, which is a type of acapella. And this is going to be used to help clear secretions out of those deep airways and help move the mucus to the central airways. This is a positive expiratory pressure device, and it comes with a flutter valve on the inside that you can change the resistance to on the bottom of the device. And so typically we start that at one of the least amount of resistance. And that flutter valve is going to vibrate, and it's also going to vibrate into your airways, causing the secretions to move. And it also creates a positive pressure that helps to improve the alveoli's ability to remain open. And it's going to help with oxygenation, and it is going to help move secretions. So let me show you how to do this. So go ahead and take this. I want you to place your elbows onto the table, have your head and neck and shoulders relaxed. I want you to seal your mouth on the mouthpiece. And don't pull the mouthpiece off. And so then you're going to take a breath in through your nose for 3 seconds and then blow out for about 9 seconds. Good, so you're going to do this 5 to 10 times, and after those 5 to 10 times, that'll be 1 cycle, and you're going to do that for 4 cycles. And after you're done, in between cycles, do just normal breathing. If you feel the need to, or feel the mucus has moved, you can check by puffing. And that would be like you're steaming up a mirror. Good.
So our patient has some secretions in his lungs. First we would auscultate to determine the area of secretions. So after that we've determined that it is the left posterior lung, and we are going to percuss that area to break up the secretions. Then following that we will vibrate the area to push the secretions towards the central airways, and that will be followed by a cough to clear secretions. So we're going to start by putting down this towel so we have some adequate protection here. And then we're going to percuss. We're going to vibrate. And then we're going to cough. Good.
Okay, now that you've had the percussion and vibration and you have some secretions in your central airways, I'm going to help you cough so we can expel those secretions, okay? So for this, I want you to inhale and exhale as you would normally. And as you inhale, I'm going to provide some quick stretches down your abdomen here. And then as you finish inhaling, I want you to pause and hold your breath and turn away. And as you exhale, I want you to forcefully try to cough, and I will apply some downward and upward pressure to help you finish exhaling the cough.
Okay.
Sound okay?
Mm-hmm.
Okay. So go ahead and breathe in and breathe out. Breathe out. Okay. Inhale now. Pause, turn your head, and exhale and cough.
Okay, so next we're gonna do active cycle breathing technique, which is a way to help clear your airways of some of the secretions. So before we do this, we will pre and post oxygenate, since his O2 levels will probably go down. So just to make sure everything's safe. So the first thing that we'll do is called breathing control. So I want you to put your hand on your diaphragm, your stomach. All right, just relax your shoulders. Now lift your head. And I want you to take a deep breath in through your nose and gentle out through your mouth. Good, so we'll do that about 5 times. And that is cycle 1. Cycle 2 is called deep breathing. So this will focus more on rib expansion. So place your hands on your ribs and you'll feel your ribs expand and then collapse. So take a breath in, hold for about 3 seconds, and then deeper breath out. Good. So that again, you'll do for about 5. 3 to 4 is okay. And the last one, I want you to put your hand in front of your face. Imagine that you're trying to fog up a mirror. So take a breath in and then forcefully breath out. Good. And you might feel like you have to cough, and that's okay.
So now that I have miraculously healed from my spinal cord injury, I'm going to teach my new patient how to do diaphragmatic breathing. So diaphragmatic breathing is a technique that allows you to get air into your lungs easier. And so with your restriction from your spinal cord injury, it'll help you get more air into your lungs. So what we're going to do is I'm going to put my hand on your upper chest, okay, and on your lower rib cage, okay. And so what I want you to do is I want you to take a deep breath in, and I'm going to put pressure on the upper ribs and allow the abdominals to rise. And then when you breathe out, I'm going to put pressure on the lower chest wall and then allow the upper chest wall to rise to let air leave. And so now that I've done it, do you think you could do that?
Yep, I think I can.
Okay. So another easier way that you can allow air to come in other than diaphragmatic breathing is called sniffing. And so with sniffing, what you're going to do is you're going to take short, quick breaths through your nose in all the way until you feel completely full, and then you're going to take one large breath out. So that'll look like hold it and then breathe out. Okay.
Do you know who invented the hospital gown? Dr. Seymour Butts.
Other potential treatments for this patient include autogenic drainage, which is similar to the active cycle breathing technique to clear secretions, self-manual assisted cough, which is similar to assisted cough with a therapist, but allows you to independently clear secretions, and sustained maximal inspiration, which is similar to stack breathing, but requires an incentive spirometer pictured here to allow visual feedback. A special thanks to Dr. Sujoy Bose for teaching us CardioPulm.